Hi, I'm Samantha Dickson, bariatric nurse at Healthier Weight, and I'm here to answer any questions that you may have this evening. And this is a question from Carol. Why is it so important to stick to the liquid and puree stages of my diet after surgery? Well, the number one reason is with any of the weight loss surgery procedures that you have, there will be a degree of swelling caused by the surgery. So you need to follow the fluid diet mainly for 2 weeks and then the soft puree diet for at least 2 weeks post-surgery to allow this swelling to settle down, and also for you to get used to your new weight loss surgery, whether it's the gastric band, the balloon, the sleeve procedure or gastric bypass procedure. And this is a question from Jane. I'm 3 weeks post-op and have no restriction. How soon can I get an adjustment? Okay, that's perfectly normal and it's actually a good sign that you're recovering well from the surgery. It is normal at usually around 3 weeks post-op that you do start to feel a bit of hunger, and that indicates that all the swelling caused by the surgery is settling down. Your first band adjustment is usually around 5 to 6 weeks post-op. You need to make sure that your abdomen and tummy is fully healed following the surgery. You need to make sure that you're on a nice crunchy textured diet, and usually when you start that diet you do start to feel an increase in restriction following the surgery, and us nurses need you to be ensured that you're following that so that we can assess your level of restriction to assess what kind of adjustment you need. Okay, it's from Andrew. I can't seem to keep fluids down. What do I do? Well, that indicates that something's wrong and you would certainly need to phone in to Healthier Weight and speak to one of our nurses. If it's outside clinic hours, we have our emergency line, which is manned from 7 AM until 10 PM in the evening. So that would indicate that there's a problem with the band and you may need some fluid out of the band, and it's very important to get the advice and necessary treatment as soon as possible. Okay, and a question from Ben, is bruising after surgery normal? Yes, it's perfectly normal. Some patients are very fortunate and can get away with it completely, whereas some patients can have some bruising across the incision sites, particularly when you've had the gastric band procedure where the port is attached to the stomach muscles. Sometimes you can have some increased bruising around that area as well. But if you're concerned about any level of bruising, again, that's another reason for you to contact us at Healthier Weight and ask to speak with a nurse, and we would be able to assess you and advise you accordingly. Okay, and a question from Jessica. How long do I have to wait between adjustments? Usually it's around 4 weeks post-op. There's a number of reasons for that. Firstly, it can take at least 7 to 10 days for an adjustment to take effect. Following the band adjustment, you're on a fluid diet for 3 days and then a soft diet for 3 days, and then you progress onto the crunchy textured diet. And that's when sometimes you start to feel the increase in restriction, if you do at all. And you have to learn to adapt to your new eating regime, as in chewing your food properly, taking your time, eating the correct foods. Plus, we want to ensure that we're not accessing the port too frequently either. So that would be another reason why there would be 4 weeks between adjustments. Okay, and this is a question from Francesca. Does flying on a plane affect a gastric band? Yes, it can. It depends. Some people can fly on a plane following gastric band surgery and not have any difficulties or feel any difference in sensation at all. Usually the rule of thumb is if you're going on a long haul flight, there can be an increase in restriction, because generally on any flights we tend to swell up, so the neck of the stomach can swell up. Plus, as what our hostesses complain about a lot, we tend to fill up with a lot of wind as well, and when you have the gastric band and you fill up with wind, that can cause an increase in restriction in the gastric band. Plus, if you're going to a hot climate as well, you need to think that again you can swell up and be more full of fluid and that can cause difficulties when tolerating diet. So really the rule of thumb is if you're planning on going on any length of flight at all, just consult with the nurses or the aftercare team at Healthier Weight and they'll be able to advise you accordingly. Okay, and a question from Kim. I've been told not to eat and drink at the same time. Why is this? There's a number of reasons why we ask you to avoid this. One of the reasons would be that if you eat and drink together, there is a likelihood that you could push the fluid through into the stomach too quickly. Another reason is that you can make the food too moist, so it makes it almost like a slider soft food, which we ask you to avoid with all weight loss surgery. So generally we ask you to avoid that. Okay, and a question from Leslie. How do I know if my band is too tight? So can I tell if my band is too tight? One of the signs would be that you have difficulty tolerating crunchy textured foods. And if that's the case, if you feel that the band is too tight, you certainly need to contact us at Healthier Weight. If you're having difficulty with fluids in that they're not going down and you're regurgitating frequently, that's a sign that definitely the band is too tight and you need to contact us sooner rather than later. Other signs that could indicate that the band is too tight is that you're experiencing some heartburn or experiencing some reflux at night when you lie down, or a nighttime cough. Basically, any symptoms such as frequent regurgitation, heartburn or reflux, you need to let us know and we can assess you. Okay, and this is a question from Samantha. When can I go swimming after surgery? Really, the rule of thumb with that is that you need to make sure that the incision sites, the wounds across your tummy, have healed completely, so that they've healed into nice pink scars and there's no scabs or open wounds. And I would always recommend that you start off nice and slowly and listen to your body. And this is from Sue. I tend to feel like my band is tighter after coming home from the gym. Why is this? It could be that increase in exertion can cause a reduction in appetite. Generally, it could be maybe that you haven't eaten in a long time. There could be a long gaps between meals. And generally, most people wouldn't be that hungry after going to the gym, so that could be one of the reasons there too. If you feel that the band is that wee bit tighter, you would start off by maybe having something more fluids and then increase to the textures later on. Okay, then this is a question from Alison. I take cocodamol for back pain before my operation. I was able to eat lots of fibre and fruit and veg to combat the side effects of being constipated. I don't want to rely on laxatives, so are there any suggestions on what I can do now my intake is lower? Well, there's no reason why you can't still have a diet that's rich in fibre, which is essential for normal activity of the bowels. So, constipation can be a common issue following the gastric band, mainly because your intake is reduced. Sometimes your tolerance of some fruit and veg can be reduced until you get into the good habit of chewing your food and taking your time. And also because we don't recommend that you eat and drink together, your fluid intake can sometimes fall below what we would recommend. Really, there's a number of things that you can do. There's useful apps on your phone that can help remind you to increase your fluid intake to around 2 litres a day by eating a healthy, balanced diet and making sure that half of your plate is full of salad or veg. Will certainly increase the fibre content of your diet. But say if you are dependent on the likes of cocodamol for pain relief, there are natural remedies that you can try, the likes of prune juice and things like that there. Again, everybody's individual, so we would recommend that you call in if you're having difficulties, ask to speak with a nurse and we'll call you and assess your individual case. Okay, Mary, my hair is falling out a bit. Can I do anything to stop it? Well, certainly we would need to assess to find out why this is happening. There can be a number of reasons. It can be quite common after weight loss surgery because obviously there's a dramatic change in your dietary intake. One of the main culprits is that your protein intake isn't enough, and one of the main reasons for that is that meat can sometimes be difficult to tolerate following the procedure. Again, this is the importance of you attending your appointments following your weight loss surgery so that we can assess your intake and also give you hints and tips on how to, for instance, increase your protein intake. Plus, we do recommend that you take a good multivitamin and mineral as well, because sometimes hair loss can be linked to low zinc and selenium as well. So basically, you need to come in for an assessment with the nurse and she can assess your dietary intake to find out the true reason why that's happening. And this is another question from Francesca. How would I know if my band has slipped? Generally, if your band has slipped, you've been having problems in the sense that you haven't been able to tolerate a crunchy textured diet. You're maybe having difficulty with fluids. You may be having symptoms of heartburn or reflux at night. To be honest, the only true indication that a band is slipped is that we need to perform a barium swallow. Now, we don't necessarily need to rush to that straight away. Again, I would recommend that you phone in and speak with one of our nursing team, or come in for an appointment. Certainly, if you're concerned the band is slipped, it needs to be addressed sooner rather than later. So I would recommend that you would phone in, ask to speak with a nurse. She can take a history and be able to advise you accordingly. Okay. And this is a question from Sarah. How long will it take for my wounds to heal? How long will it take for the scars to fade? Again, that's very individual. They're generally, most of our surgeons would close the wounds with soluble sutures and glue, so they tend to heal quite quickly with that. And usually we have a nice pink scar by around 3 to 4 weeks, with maybe some residual scabbing. A scar can take at least 2 years to fully heal, and as long as you look after it, they tend to fade away very nicely. However, again, everybody scars differently. Some people can be maybe prone to, say, the likes of keloid scars. But generally, the things that you can do to help your scars to heal would be to follow our wound care advice to prevent the risk of infection, to not smoke, and to not expose them to sunlight. And again, if you have any queries regarding your wounds, we would recommend for you to give us a call. And this is Francesca again. How do I know if I need another adjustment? Well, as regards the signs that you need a band adjustment could be that 1, your weight loss has stopped or has slowed down. 2 could be that your portion sizes are starting to increase. Or 3, it could be or portion sizes are starting to increase and you're starting to develop a bit of hunger. So again, make an appointment for a review with the nurse, and she would be able to assess to see whether you need a band adjustment. Okay, and another question has come through. Why do I get shoulder pain after I eat? That can be related to possibly you eating too quickly or eating too much, and it's basically because the nerves at the neck of the stomach are situated near to the diaphragm that feeds the left shoulder. So sometimes if you overeat or eat too quickly and it causes swelling, it can irritate this nerve that feeds the left shoulder, and you can have a bit of pain there. So usually we would advise you to slow down eating, to make sure that you're chewing your food properly, and to not eat for more than 20 minutes in one sitting. And another question, when can I take a bath after surgery? I would recommend that you don't have a bath until the wounds have healed into nice pink scars, that there's no more scabs, no more open wounds, that it's a nice pink scar. Okay, when can I start getting into gym style workouts? Okay, following any of the weight loss surgeries, you need to be up and about as soon as possible. That helps minimize any risk of post-op complications such as blood clots, but it also helps minimize any pain caused by stiffness caused by the surgery, and also the collection of wind, which can cause left shoulder tip pain or discomfort in the chest or the back. As regards going back to the gym, any strenuous exercise, weightlifting, running, generally wait for about 6 weeks post-op. And again, I would recommend that you go nice and gentle to begin with. Listen to your body. If you're quite sore the next day, maybe you need to step it back a bit and just do it more gradual. The important thing is just to listen to your body. Okay, and another question. I've received an egg timer in the post. What do I do with it? Okay, that's to help you. It's an aid to help you to slow down eating, which a lot of us need to do anyway, because generally we eat too quickly, we don't chew our food properly, and when you've had weight loss surgery, this can lead to problems such as food getting stuck, which can cause discomfort or can cause you to regurgitate, which we don't want to happen, and certainly don't want to happen frequently. So generally, the egg timer helps you slow down, in that you take a small mouthful of food, chew it, swallow it, and then turn the timer around, and that indicates you need to wait until the timer runs out, and that indicates when you can take your next mouthful of food. It is a very good prompt to help you slow down, and you'll be very surprised how quickly we all do eat and how much we need to slow down. Okay, I get heartburn after I eat. Is this normal? And that's from Neil. No, it's not normal. It's an indication that something's not quite right. It could be possibly that you've eaten too much or that you've eaten too quickly. So again, speaking to a member of the aftercare team or one of our nurses will be able to assess what exactly is happening and hopefully be able to resolve that issue. Okay, a question from Helen. Can I use a sunbed after surgery? Can I expose my scars? Generally, the rule of thumb is no. If you expose the scars to sunlight or a sunbed, you can cause hyperpigmentation, which can cause your scar to be more noticeable and not scar very well. So generally, I would recommend no. Okay, thanks for watching everybody, and thanks for your questions. If we didn't have time to answer your question, or if you require further medical advice, please give us a call on 0121 693 4488, and thanks again.